Have you ever really stopped to think about how chemotherapy works? I mean, how can a medicine be strong enough to fight cancer but also be so tough on the body? Well, today, we are going to map it out visually. We're going to walk through how it targets cancer, why it causes all those side effects, and what you absolutely need to know as a future nurse. By the time we're done, you'll have this whole process locked in as a clear visual in your head. Ready? Let's get into it. So, this is the big question, right? How does a drug that's flowing through your entire body know which cells are the bad guys? It sounds almost impossible, but the answer isn't some kind of magic. It's pure biology. And if you can grasp this one simple principle, I promise, everything else about chemo is going to click into place for your exams. Okay, first things first, let's frame this the right way. I want you to think of chemotherapy, or antineoplastic medication if you want to be formal, as a highly specialized weapon. It's built for one mission and one mission only: find and destroy the enemy, which in this case is cancer cells. So, what exactly is this weapon? Well, an antineoplastic med is basically a cellular saboteur. Its whole job is to either kill cancer cells outright or to totally mess up their ability to reproduce, to stop them from multiplying. And the goal can be different for different people. Sometimes it's for a cure, sometimes it's to increase survival time, or sometimes it's just to decrease complications and improve quality of life. Now, for the really cool part, the strategy. How does this weapon actually find its target? This is where we get into the nuts and bolts, the how behind the whole mission. And here it is. This is the secret. Chemo doesn't actually see a little cancer sign on a cell. Nope, it's programmed like a heat-seeking missile for one thing and one thing only: cells that are dividing fast. And that, right there, is cancer's defining feature, this out-of-control growth. It's also its biggest weakness. To really get how chemo finds its target, you gotta look at the map it uses, which is the cell cycle. Think of it like a cell's life story. You've got 4 main chapters. G1 is where it grows and gets ready. S is the big one. It's where it duplicates all its DNA blueprints. G2 is the final check. And M is mitosis, where it splits into 2. Now, cancer cells, they're stuck on a speed read, just racing through this cycle over and over again. And what's really clever is that different chemo drugs have different plans of attack based on that map. Some are phase-specific. Think of these like a sniper, designed to hit the cell only during a very specific window, like the S phase when it's copying its DNA. Then you have the phase non-specific drugs. These are more like a grenade. They can damage the cell at pretty much any point in the cycle. This is why doctors often use a combination of drugs to attack the cancer from every possible angle. All right, so this leads us to the big problem in our story. The weapon is powerful, for sure, but its targeting system isn't perfect. And this lack of precision leads to what we call collateral damage. Basically, unintended harm to healthy parts of the body. And this right here, this is the reason for every single side effect we're about to talk about. Remember that target? Rapidly dividing cells. Well, the problem is, our bodies have lots of healthy, normal cells that also divide quickly as part of their job. And chemotherapy, it just can't tell the difference between the good guys and the bad guys. Now, ground zero for this collateral damage is the bone marrow. Your bone marrow is like a factory that's running 24/7, just churning out all of your blood cells. When chemo hits it, it's like a power outage. Red blood cell production drops, and you get anemia, which is why patients are so tired. White blood cell production stops, and you get neutropenia, which crushes the immune system. And platelet production tanks, causing thrombocytopenia, which means a huge risk for bleeding. Okay, if you're going to memorize anything for your exam, burn this number into your brain: 50,000. When a patient's platelet count drops below 50,000, that is a critical value. It's go time. You need to initiate bleeding precautions immediately, because at this point, even a tiny bump could cause serious bleeding. And here is the other magic number you have got to know: 1,000. This is for the absolute neutrophil count, or ANC. Neutrophils are the frontline soldiers of your immune system. When the ANC drops below 1,000, the body's defenses are basically gone. The patient is at a massive risk for a deadly infection. This is when we start neutropenic precautions to protect them from literally everything. But the damage doesn't stop in the bone marrow. Think about it. What other cells in our body divide quickly? The lining of our entire GI tract, from the mouth all the way down. That's why chemo can cause horrible mouth sores, nausea, and diarrhea. And of course, the most famous one, hair follicles. They're basically tiny, fast-growing cell factories, which makes them a perfect, unintended target for chemo's friendly fire. Now here's a weird twist.
Sometimes chemo can work a little too well, all at once. When it destroys a ton of cancer cells in a short period of time, all those dead cells burst open and spill their guts into the bloodstream. And all that cell junk includes a whole lot of uric acid. This can totally overwhelm the kidneys and lead to a really dangerous condition called tumor lysis syndrome. It's why you'll often see patients on a drug called allopurinol. It helps the body deal with all that uric acid and protects the kidneys.
So, if chemotherapy is the weapon, you can think of the nurse as the battlefield medic. Our job is to manage all that collateral damage. It's to see problems coming before they happen and to keep the patient safe while the treatment does its thing. So, let's look at some of the most important nursing interventions.
One of the scariest risks with IV chemo is something called extravasation. This is when the drug leaks out of the vein and seeps into the tissue around it. And some of these chemo drugs are so potent, they're called vesicants, they can literally eat away at the tissue, causing it to die. This is a 5-alarm fire, a true medical emergency, and it's why nurses watch that IV site like a hawk. Nurses are also the first line of defense against a life-threatening allergic reaction called anaphylaxis. If your patient is getting chemo and suddenly can't breathe or breaks out in hives, it is a race against the clock. And the first, most important thing you do no matter what, you stop the medication immediately. That one action can save a life. Then it's all hands on deck. Call for help, get oxygen on, and be ready with those emergency meds. This slide right here is basically your nursing care plan cheat sheet. You can really break it down into a few key jobs. First, you've got monitoring and preventing. That's watching those lab values like the CBC and platelets, giving anti-nausea meds before the chemo even starts, and pushing fluids. Second, it's all about patient education, teaching them why they need to use a soft toothbrush or an electric razor. And third, it's coordinating care, making sure the patient knows to check with their doctor before getting any vaccines, because that could be really dangerous with a weakened immune system. So let's end with one final question to bring it all home. Your patient is on chemo, and they spike a new fever. What does that signal to you? In a patient who is likely neutropenic, a fever might be the only sign of a raging, life-threatening infection. It is a medical emergency, and your priority action is to get help right now. Because you understand the pathophysiology. You understand that the collateral damage has left your patient completely defenseless, and that is the power of having a clear mental map.